Alright, this video is going to probably get a little bit ranty. Because honestly, I'm just kind of going, you know, this is sort of improv right here. I mean, most of my videos are, but this one in particular. Alright, this smug little shit is a Representative Jason Chaffetz. Is, of course, a Republican from Utah, and he has a very recent claim to fame in that a couple days ago, he went on CNN and claimed that, oh, well, you know, people who aren't very well off might just, you know, the simple fact of life is that, you know, the people who have trouble affording health care need to be adults and recognize that they might have to decide between getting a new iPhone and paying for health care. Now, this statement, okay, healthcare in America is a very difficult subject for me to cover. If you go back through my videos, for the most part, I don't touch on it too much, even though it is one of the most important issues facing our country right now. And that is because I've been there. I've been on multiple angles of dealing with healthcare in this country. And I've seen the negatives and the downsides firsthand. And when people like this say statements like that, oh, well, maybe you should manage your money better, then you could afford healthcare. God, it grinds my gears. It truly pisses me off because people like this sumbitch have no fucking idea what it's like to actually have to worry about things like that. To have to make that choice. Not to mention the fact that in a lot of cases it's not even a choice. Like, alright, my healthcare. Right now I have fairly decent healthcare. I mean, it's okay. Who knows? I mean, open enrollment's coming up with where I'm working. They might screw it up for next year. I don't know. We'll see. But my employer provided healthcare that I pay for out of every check alone costs more than a fucking iPhone. Alright, healthcare is not something that is an option anymore. Alright? And it is not something that you can say like, oh, well, maybe you should have a health savings account. Maybe you should just forgo getting a new iPhone or a new car or whatever and put that money towards saving for your health care. Okay, well, let me say this. How are you supposed to pay? How exactly are you supposed to save enough to pay for health care with a health savings account? Or really anything else other than health insurance? Because, you know, my last experience I had with a family member who went to an emergency room. After the visit, when we finally got the bill, after insurance had finished paying what they felt they should pay, the bill was about $700. Okay, so that's about the cost of an iPhone. So what was done during that visit? 3 x-rays. That's it. For an ER visit that resulted in no treatment and 3 x-rays being taken, our end of it that we were expected to pay was already more expensive than a fucking iPhone. Now, exactly how is foregoing new electronics supposed to help someone pay for chemotherapy? for cancer treatments, or hell, for that matter, how is it supposed to allow them to pay to even be diagnosed? Considering a lot of the tests used to diagnose, say, a condition like cancer are so expensive, insurance companies already bitch about paying for them. But those are just some of the sacrifices you're going to have to make. So, exactly where are you supposed to make these sacrifices when you have, say, $100 left over after your bills at the end of the month, and insurance premiums that are going to be $300? Where exactly are you supposed to make this sacrifice? And that's the thing, like, that's one of the areas that just pisses me off with people like this. Like I said, they have no idea. Nor do they really even care. Alright? They have donors, and their donors want things. And they either provide those things, or they don't get the money, they don't get reelected, they don't get to stay in those nice cushy offices in Washington with their very nice government paid for health care. And that's just something they can't handle. And when it comes down to, like, this whole, these people like this, they have no idea what life is like, what dealing with healthcare is like to the average American. I'll share one more story with you. Something that this asshole, again, I guarantee you, has no idea about. Has no idea what it feels like to have to deal with it. Another thing that a lot of right-wingers talk about when people bring up the subject of someone being uninsured is they like to always harp on the fact that they always like to say, like, oh, well, just go to the ER. Well, if you're sick, go to the emergency room. They have to take you. They have to care for you. No, actually. What an ER is required to do by law is, when you actually read those signs at emergency rooms, it says it very plainly. That regardless of your ability to pay, they have to provide basically like life-saving, stabilizing care. Stabilizing is the important part. They don't have to, like, if you come in with a broken arm, they have to put it, they may have to put it in a cast for you. They don't have to see you again to take fresh x-rays and to put on a new cast, things like that, as you go through the process of a healing. They don't have to do that. If it is not life-threatening, if you go in there and say, oh, I've got cancer, I need chemo, nothing we can do for you, pal. There's the door. That's not an emergency. Now, once your cancer spreads to the point that you're about to die, they can take care of you then. It's too late to do anything. But then you can get some treatment. Maybe they'll give you some morphine while they wait for you to die. To go and say something like that is it's a lie. To say, like, oh, if you're sick, you can always just go to the emergency room is absolute bullshit. Because, yeah, if you have a life-threatening immediate injury or illness, you can go to the emergency room and you can receive enough treatment to keep you from dying on that day. But that is it. Alright, case in point, I had a family member of mine that actually had tripped and actually had a fracture in the shoulder. No, it was in the humerus, in her elbow. And didn't have insurance. It was currently sort of in between work insurance and Medicare. And broke a bone in her arm and went to the ER. Now, the ER took x-rays, told her that the bone was broken, put her arm in a sling, told her the bone was broken and would need surgery to repair, put her arm in a sling and sent her home. They didn't do the surgery there, they didn't fix it, they didn't do anything else, because it's not life-threatening. And without insurance, that surgery was going to cost in the neighborhood of about $18,000. Again, Chaffetz, how exactly is somebody who is currently transitioning from work insurance to Medicare because they're retiring and has that little gap there, how are they supposed to come up with 18 grand? So I'm all ears. Is that going to be, would that be going without a new iPhone, or would that be a health savings account? These jackasses. Alright, well, hopefully that was not too depressing and ranty. And I would like to add just one final thing, in case it wasn't clear so far. Fuck this guy. I mean, really. Burn in hell. So, links will be in the description, including the infuriating video in which he's like, oh, well, the poor people, they should just forgo a new cell phone. You can pay for your healthcare that way. Like hell. This guy has no idea, has no fucking clue what he's talking about, and he's one of the ones in charge of telling me and you and everyone you know how they need to live their lives and how they need to come up with the money to pay for their healthcare. And he has no idea what he's talking about. Where was I? Okay, yeah, end of the video. So, like, comment, and subscribe. Links will be in the description. I'll see you next time.